Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam from Houston, Texas. This is a presentation on cough, congestion, mucus, fever, aches, which is your real problem. You need to choose the right kind of cold or flu medication so that you are appropriately treating your condition. By choosing the wrong type of a medication, you could be lingering on with your symptoms for days. It happened to my daughter, and that's why I'm making this presentation. She was having cough with mucus production, and she was taking cough suppressant, which is not the right thing to do. But once she started taking the expectorant, things begin to improve. So let us find out what is the actual problem that you're dealing with and see what is the most appropriate medication. Most of these are over the counter, some of them are with prescriptions, but I'm going to give you a general overview of what medications work under what conditions. This is for educational purposes only. This is not a medical advice. Please consult with your physician when based upon your presentation, your history, your allergies, your coexisting conditions like hypertension, diabetes, heart disease, kidney problem, all of these have to be taken into consideration before a right medication is prescribed for you. So when you go to the drugstore, you have a misery of choices as what you can take and what you cannot take. Or you just ask your friend who had the similar symptoms before, and then you just go with his advice, not knowing what his complete medical history is. So let us try to simplify these things. There are only about 3 or 4 common conditions during fall or during summer when people experience certain upper respiratory infections. The most common of which is with the seasons, we have the seasonal allergies. The seasonal allergies are where people wake up with congestion, running nose, burning eyes, scratchy throat, and generally it kind of resolves over a period of several hours, like in the afternoon or by late afternoon, you'll be feeling normal. So those are seasonal allergies. It is not an infection, it is a reaction to the pollen or dust around you. Flu, on the other hand, is caused by a virus and it is associated with fever, cough, congestion, burning in the chest, like some mucus production, and that's a whole different ball game compared to seasonal allergies. The next thing is, of course, COVID, which is on everybody's mind. COVID has a little different presentation. It presents with the fever, aches, severe headache, body pain, along with cough. Could be dry cough, it could be productive cough, and so these are some of the symptoms, and they can come on very quickly. And of course, we have a case of a bronchitis, which is sort of uncommon now with the COVID rampant going on all over the country and all over the world for that matter. Bronchitis with fever, little hacking cough, mucus production. So this is a different condition altogether. Then we have chronic lungers, people with COPD, people with severe bronchitis who have this dry, chronic, agonizing cough. The treatment for that is different. So let us begin with how we select the medications. Let's say you have a seasonal allergy, just congestion, for which you basically need an antihistamine or antihistamine. It could be Zyrtec, Benadryl, Claritin, and the important thing is to make sure you select these drugs which are long acting and which do not have any effect on your cardiovascular system, because if you're having high blood pressure or heart disease, they can have adverse effects, and that's I'm going to talk about when I talk about cold medications. And make sure you take the right medication for the right indication. If your doctor has diagnosed that you have seasonal allergies, taking Claritin 1 tablet in the morning may help to minimize your symptoms. It may not completely eliminate, but it may help to minimize your symptoms. The same thing, most people don't take Benadryl because it causes drowsiness, and when you're driving to work in the morning, that's the last thing you want with a running nose and a itchy eyes and all these things. Zyrtec, there are many other antihistamines, like here's a list of the antihistamines that you feel what is most comfortable and how your body responds to each one of these drugs. Claritin is a pretty good medication. It does not cause drowsiness. It lasts for more than 12 hours. It is once a day, 10 milligrams, and you can take that. And if it works for you, that's fine. If it doesn't work, then you have to talk to your primary care doctor. So those are the medications for seasonal allergies and a minor cough and cold and irritations. Then let's talk about, let's say you got a viral infection with fever, cough, running nose, congestion, and aches and pains. So you got too many symptoms. But the main thing is virus. What is the story about the virus? It's going to run its course, 3 days or 5 days, no matter what you do. Whatever you're doing is to suppress the way your body is responding by reducing congestion, by reducing cough, by reducing mucus production, or getting rid of the mucus production. So the focus should be on, one, bring the temperature down. Number two, keep your hydration very well, because especially if you have heart disease or high blood pressure, low blood pressure can be quite devastating. And number three, take the right kind of medications. If you're having heart problem or high blood pressure, don't take any medications that increases the blood pressure, like the dextromethorphan or DM. Watch out for that DM, like this DM here, as you can see, that is a no-no if you're having heart disease or high blood pressure, because it increases the sympathetic activity. As a result, your blood pressure may go up and you may experience palpitations and things like that. So you have to select the right medication. You need to talk to your primary doctor and tell them exactly what is your major symptom. If it's running nose, congestion, and all these things, start off with Claritin. And then if you're having cough with phlegm or mucus production, then you need an expectorant. An expectorant is something that loosens up the secretions in the lungs, and then it helps you to get them out easily. If it's a thick secretion, you just can't cough. You cough, you keep coughing, and that irritates the airways more. You get exhausted, frustrated, and this is like a catch-22. So you are having mucus production or even phlegm in the morning, then try something like Mucinex. The underlying generic name is the guaifacin. This one, Guaifacin, guaifacin, 600 milligrams. The max dose is 1200 milligrams. You want to take this one to loosen up the secretions, get rid of the mucus, because that's the most important thing. You want to get rid of the mucus. And make sure you don't take one with the DM, because on one hand, you are trying to loosen up your secretions and all these things. On the other hand, you're adding this dextromethorphan, which is a sympathomimetic drug that stimulates sympathetic activity, leading to increased heart rate, blood pressure, which can be dangerous if you're having high blood pressure to start with. Okay, here's what Mucinex does. It loosens up the secretions in your lungs, so it helps you to cough up that junk. You need to get rid of that junk, because letting it settle in the lungs is bad, because that's going to lead to more infection. It acts like a fertilizer for the bacteria or the virus. Next thing is, so you are having cough with mucus. As I said, already touched upon this, but you see a lot of these drugs. When you see that, the most important thing you need to know is what else does this have besides guaifacin, which is the cough expectorant medication. As you can see, there's a DM, and anything that says DM, you need to be careful, especially if you're in the age group with heart disease, hypertension, and other medical conditions. So choose the right medication for the right indication. Now let's look at this mucus and phlegm. And I've been stressing upon this because a lot of times people take cough suppressants when they are having when they are coughing. You can feel that they are having mucus in their chest. They can't get it out, and they are taking all these cough suppressants, which is the wrong medication to do. And that's why you're not feeling better after 6 days, 7 days, and say, what the heck is this? I went to the best specialist, and why didn't they get me the right medication? Well, you have to be an intelligent consumer. Okay, cough, you see, cough, congestion, chest pain, fever. You get a combination. Okay, so when you are having these symptoms, make sure when you look at this, oh, when this cures everything I have. I said, not necessarily. If you are having a heart problem, you could be making your condition worse, and especially if you have a blood pressure problem. And Tesolon is a medication that primarily suppresses the cough reflex in the brain. And where would we need it? This is needed in patients with like chronic lung condition who are bothered all night with this dry cough. They don't have much mucus. They're just coughing all night. And for those people, Tesolon pills may be an option. A Tesolon pills may also be an option if you're having very thin mucus, not a whole lot, and you're bothered with the cough in the night. You can take it at the night time to sleep better, so that in the morning you take the expectorant to get rid of whatever that mucus plug may be. So, ladies and gentlemen, it is important to understand first of all, what are you having? Seasonal allergies, flu, COVID, bronchitis, or COPD, dry chronic cough, smoker's cough. Then choose the right medication, and I'll tell you, you will be feeling a lot better than just indiscriminately taking a combo and finding out, why am I not getting better? The reason is because you're taking the wrong medication. So let's change the course and hope you feel better. Thank you so much for watching this presentation, and please do share it with your friends who can benefit from this one. And this is not a medical advice. Thank you so much.